My name is Rebecca Salter, and I will be doing a speech about medical marijuana, an informative speech. And my speech class is Speech 1321 NT Fall 2015. And medical marijuana is not the drug of the rebellious teenager, or the 1970s hippie, or even the grass of famous country singer Willie Nelson. But it is a new medicine that has multiple ways of consumption, a new medical pain reliever for many illnesses, symptoms, and is approved in many U.S. states, with each having their own application process. And no matter, this is, once again, it is used, we are talking mainly about it being used as a pain reliever and not a cure for any illness, but to ease with symptoms of illnesses or other things, ailments in life that require the use of medical marijuana to ease that pain, to help your life more livable and as normal as possible. And by consuming cannabis in its different forms, you obtain a different effect depending on how you consume it and what you're consuming. The most common way that everyone is at least familiar with is smoking it. And also, this is not the joint being passed around a party. This is a small medical grade marijuana that is measured, that is used in a small pipe or water bong, that has the most effect, that is giving you a large amount of the THC. So like I said, it is not the joint being passed around at parties. This is basically someone's medicine that they take morning, noon, and night. Next, the most preferred medical way of consuming marijuana is vaporizing. Vaporizing only heats up the active ingredients in the plant. So you're not getting all that extra, you're just getting the active ingredients, and that's all you're getting. So like I said, in the medical field, it is the most preferred, healthiest way. Next is edibles, which are more of a body high than they are in a head high. It lasts a significant amount longer than it would be if you took it off a pipe or a bong or even vaporizing. It is a concentrated amount that you're getting, without all the smoke, without all the lighting, without all the fire. That also, eating of the raw leaves or juicing is an amazing way to obtain most of the health benefits of marijuana without getting high. Last but not least, there is essential hemp oils, which is the true medicine of cannabis. Oils are strong concentrates of the active ingredients and provide significant curative powers. So no matter your ailment, there are multiple ways to consume medical marijuana to ease your symptoms. And speaking of symptoms, there are many illnesses that some you may know about, some you may not, that if you happen to live in one of the states that it is approved in, you most likely could have a prescription written for you for medical marijuana. The first illness is the treatment for the symptoms of AIDS, which is the end outcome of being infected with HIV. And the symptoms of AIDS are not limited to fever or night sweats, fatigue, and recurring infections, which you could see how, just going over the few ways that you can consume it just a minute ago, you could see where one of those consumptions could help the symptoms of AIDS just by you reading it. Next, which most people do know about, associated with medical marijuana, but I'm sure they did not know that there were two different types of glaucoma. The most common type is open-angle glaucoma, which often has no symptoms other than slow vision loss. Angle closure glaucoma, although rare, is a medical emergency, and its symptoms include eye pain with nausea and sudden vision disturbances, which again is not used for a cure but as a pain reliever for most of these symptoms. The next one is another condition is a disease that affects the nerves or nerve cells, as in epilepsy. Epilepsy, also called a seizure disorder, is when a person is having a seizure, experiences abnormal behavior, symptoms, and sensations, and sometimes includes loss of consciousness. Next is more of a side effect than an illness. Nausea and vomiting associated with cancer chemotherapy can be eased with the use of medical marijuana. Next is a pain caused by structural or psychological disorders or physical disorders with psychological overlays. Another is muscular spasticity and limb pains, as in multiple sclerosis, which symptoms are varied in vision loss, pain, fatigue, and impaired coordination. Also, symptoms of movement disorders such as Parkinson's, which often start with a tremor in one hand, slow movement, stiffness, and loss of balance. Next, it being used as an appetite stimulant for diseases of malnutrition. So once again, it is not used as a cure, but it is used to boost the appetite of a person's personal chemistry. Also, if you have nausea and vomiting in general, it is also used here for a boost of appetite, but also used to ease the stomach. Last but not least, it is also a ailment that most people know about, because either they have it or they know someone who does have it. They use it for migraines. So if you have severe migraines, then it is used to ease the pain of that, and it can even kind of like helps you either get over it quicker, to where it's not as painful on your body. It helps you get through it faster. So that kind of helps you understand the use of, and it's not just in cancer patients, and it's in everyday people who have everyday lives, who are doing normal things and want to be normal and live a normal life. So in the states that have approved it, I said it was about half. It's about 23 states in our U.S. that have approved the use of medical marijuana, which it is state legal, not federally legal. The states are Alaska, Arizona, California, Colorado, Connecticut, Delaware, Hawaii, Illinois, Maine, Maryland, Massachusetts, Michigan, Minnesota, Montana, Nevada, New Hampshire, New York, New Jersey, New Mexico, Oregon, Rhode Island, Vermont, and Washington. All states require a doctor's approval, and all but Washington State require an ID card to be shown at a dispensary or an enrollment in patient registry. Many of the states that allow medical marijuana have an online application process. In most states, patients need to fill out the application, pay a fee, and provide identification information to successfully receive an ID card. In most states, patients need a signature statement from a doctor diagnosing the condition and a document stating that the medical marijuana is the treatment recommended for the patient's particular condition. So again, like, there is most definitely a process to go through it. But accordingly, like, if you have all the correct paperwork, then I mean, you really have no problem with getting the medicine that you need. Again, with the multiple ways of consumption, a medical pain reliever for many illness symptoms, and being approved in many U.S. states, it's only an application process away from being at your fingertips for personal use. So this is just the beginning of what we as people in a nation will learn about the use of marijuana in our medical field. Thank you.